Welcome student. Today we are going to learn new topic unit second, that is 2.6 drugs for a respiratory system. What is respiratory system? As we know, the respiratory system is a biological system, right? Consists of a specific organ and structure used for gas exchange in animal as well as plant, right? Respiratory system is a biological system used for mainly gas exchange. Here we study the respiratory system of human, right? Main function of respiratory system are allow you to talk and to smell, right? Another function of the respiratory system is bring air to the body temperature and moisturize it to the humidity level that is need for the body. Another function of respiratory system is to deliver oxygen to the cell, which is required for the cell for a body of human being, right, or any other animals. Then last function, remove waste gases including carbon dioxide from the body when you exhale. When we inhale, we take oxygen, and when we exhale, we eliminate carbon dioxide, right? Respiratory system is an biological system used for a mainly main function is gas exchange. Main function of respiratory system, as we know, allow you to talk and to smell, right? Then bring air to the body temperature and moisturize it to the humidity level your body needs, right? Deliver the oxygen to the cell in the body और different organ, ठीक है. Then remove waste gases including carbon dioxide from the body when you need. Let's move. What is respiratory system? Respiration. What is respiration? Respiration is lungs activity to eliminate carbon dioxide and to take up oxygen. Respiration is a lungs activity to eliminate carbon dioxide and to take up oxygen. Respiratory activity is subjected to a variety of chemicals and control non-chemical control. Actually, respiration is controlled by two factors, that is chemical factors, and second one is non-chemical control. There are two factors, one is chemical factor and second one was non-chemical control. Respiratory insufficiency is either due to ventilators failure or oxygenation failure. Prolonged bronchial narrowing and their obstruction by secretion are responsible for ventilatory failure. Narrowing of bronchial, there is obstruction by secretion, are responsible for ventilatory failure or oxygen failure. It is an main reason for oxygen failure. And non-chemical controls such as joint movement, temperature, blood flow, irritation of respiratory passage, gagging, then vomiting, swallowing are the factors that alter the rate and depth of respiration. Respiration is an lungs activity. Main function of respiration to eliminate carbon dioxide and to take up oxygen, non-chemical control factors such as joint movement, temperature, blood flow, irritation of respiratory passage, ganging, vomiting, and swallowing are the main factor that alter or change the rate of and depth of respiration. It's all about a respiratory system in general. Next, respiratory drugs. What is respiratory drugs? Those are drugs used to or use on respiratory systems are called as respiratory drugs to enhance the activity of respiratory system. Those are drugs which are used to enhance or to eliminate the respiratory system, elevate the respiratory system. Those drugs are called as respiratory drugs that are classified into five main types, and their subclasses are given in the chart. Let's discuss one by one. First, respiratory drugs. First, expectorant. Second one, mucolyte. Third one, bronchodilator. Fourth, discongestant or decongestant. Fifth one was anti-tissue. Respiratory drugs are mainly classified into five types, that is expectorant, second one mucolyte, third bronchodilator, fourth decongestant, and fifth anti-tissue. Expectorant are further classified into two main types, that is sedative expectorant. Second one was stimulant expectorant. Sedative expectorant are further classified into saline expectorant. Second one nausant expectorant, and third one was demulcent expectorant, whereas stimulant expectorant are classified into direct stimulant and reflux stimulant. It's a classification of a respiratory drugs. What is expectorant? What is main function of the respiratory drugs? The main function of the respiratory drugs, some are drugs are used in the combination to relieve cough. Main function of the respiratory drugs to relieve the cough caused by a common cold. There is so many causes, or bronchitis, then some other breathing illness. Main function of respiratory drugs to thinning and losing the mucus or phlegm or cough in the airways, cleaning the airways, cleaning the congestion, and making the breathing easier. Right? Main function of respiratory drug is to cleaning the airways while losing or thinning the mucus, cough, and making breathing easier. Got it? Next, expectorant. What is expectorant? It is a medicine which is promote the secretion of sputum or cough by the air passage, used to treat the cough produced or caused by common cold or so many other causes like breathing illness, etc. Expectorant is an respiratory drugs. Example of respiratory drugs, expectorant, it came from Latin word that is expectorer, means to drive out from the chest, means to take up and throw out from the chest. Got it? Expectorant, it came from a Latin word that is expectorer. It means to drive out from the chest, means to take up and throw out from the chest. Expectorant are the drugs which increase the production of demulcent respiratory tract fluid that cover and protect the irritated mucosa. Mucosa is an gummy like substance or phlegm or sputum. These drugs are useful in the treatment of cough due to irritation of respiratory mucosa below the epiglottis, that is in trachea and in the bronchi in the lungs. Epiglottis is the leaf-shaped flap of cartilage located behind the tongue at the top of larynx or voice box. Epiglottis is a leaf-shaped flap of cartilage located behind the tongue at the top of larynx and voice box. Expectorant are classified into two types, that is sedative expectorant and stimulant expectorant. Expectorant, it came from Latin word that is expectorer, means to drive out from the chest, means to take up from the chest and throw out, right? It is a medicine which is promote the secretion of sputum by the air passage and used to treat the cough. Got it? Next, sedative expectorant. What is sedative expectorant? Sedative expectorant, they are further classified into three types: saline expectorant, nausant expectorant, and demulcent expectorant. The coughing cause inflammation of the membrane of air passage, right? These drugs or sedative expectorant are drugs are used for the secretion of mucus which cover and protect the inflamed membrane and reduce the irritation caused due to cough. There is three main type, that is saline expectorant, nausant expectorant, and demulcent expectorant. Saline expectorant, these drugs increase the secretion in bronchial tract and also help to lose the phlegm, means cough. They are increase the secretion in the bronchial tract and also help the lose the phlegm. Example: ammonium chloride, ammonium bicarbonate, and potassium iodide are used as saline expectorant. Nausant expectorant, these drugs act as expectorant only in small amount. Nausant expectorant are used in small amount, but higher dose cause nausea and vomiting. For example of nausant expectorant is imitin. Third one, demulcent expectorant. These are gummy substance which help to coat upper respiratory tract and thus protect them. Example: syrup of acacia and ginger are the demulcent expectorant. Actually, sedative expectorant are sedative expectorant, they can make you dizzy, sleepy. If you taking the rest, when we taking the sedative expectorant, when we taking the respiratory drug that is sedative expectorant, and if you taking the rest, it is good, right? But Not so good if you are driving car or any vehicle. Next, stimulant expectorant. These drugs stimulate the output of respiratory tract fluid either directly or by reflux. Stimulant expectorant, these are drugs stimulate the output of respiratory tract fluid either directly or by reflux. Direct stimulant, certain volatile oil like eucalyptus, anise, lemon, cedarwood, as well as alcohol, when we administered by inhalation with this steam, can increase the secretion in respiratory tract. Direct stimulant, indirect stimulant, certain volatile oil like eucalyptus, anise, in Marathi anise we called as badi shop, lemon, known example of direct stimulant is lemon, then cedarwood oil, as well as some alcohol, when we administered by inhalation with steam, can increase the secretion in respiratory tract. Then, next, reflux stimulant. These drugs produce mild irritation of gastric mucosa, thereby stimulating the gastric reflux, which help to increase the respiratory tract secretion. Example, lemon, ginger, tea, coffee, etc. is an reflux stimulant. Thank you.